Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jacqueline Meredith. This episode is the first in a two-part podcast series on how to be an ally to transgender people living with HIV, featuring conversations between an HIV provider and patient advocate. In the mini-series, we will be discussing barriers and misconceptions that can interfere with engagement with HIV care, adherence to antiretroviral therapy, and other important outcomes. I'm joined by Jemma, a transgender health advocate who has been working in the community for more than 10 years at a large clinic in Thailand, and Dr. Colleen Kelley, an HIV care provider and researcher in Atlanta, Georgia. Let's first begin by discussing access to HIV care in transgender persons. Jemma, so what unique circumstances do transgender people face when trying to access HIV care for the first time?
I have to tell you about the situation in Thailand first. In Thailand, lots of people might think that or see Thailand as a paradise for trans people or LGBT people. But in fact, we do not have gender recognition law. And that brings the issues for trans people because being trans is not being recognized officially or legally under the eyes of the government or under the eyes of the Ministry of Public Health. And there has been a research saying that almost half of the trans people in Thailand, they never seen a doctor in their lifetime. And also almost half of them that went to the state hospital or any health service facility, they have faced stigma and discrimination. And they left home with stigma and discrimination and feeling bad about themselves. And that are the issues that they have to face. And they also act like the barriers for them to get access to healthcare. So for the question, how would it feel for the trans person in Thailand trying to get access to HIV testing? I would have to say they basically would be reluctant to go and get access to healthcare in general already because of their gender identity and being fear of getting stigma and discrimination. So it can be a barrier or it can be something that they have to really consider and think about before we go and have the HIV testing. So it is kind of quite a big challenge for them. Yes.
Yeah, and I would say from the, US perspective, it's fairly similar as far as having tremendous barriers for transgender people to access care. But I'd also comment that it's highly variable. In some states and in some cities, there are access to really gender affirming services for HIV care and other health care. But in the area of the country where I live in the southeastern US, I would say that that is really the exception and not the rule. And we can't forget that in the US, almost half of states have now passed anti-transgender healthcare laws. And a significant portion of our population are living in these states where healthcare is being legislated for trans people. And so this really provides an environment that leads to increased stigma and discrimination at best, and at worst can lead to, significant negative healthcare outcomes for transgender people. So I think that while there are definitely examples of places that are inclusive and accepting, and even more importantly, affirming to transgender people, that those are likely in the minority as we think about the healthcare system in the US as a whole. And that, yes, transgender people are still not seeking the healthcare that they need. And I think particularly around sexual healthcare, when we think about HIV and sexually transmitted infections, because of the additional stigma that those place onto people who are already feeling marginalized based on their gender identity.
So after a patient might be diagnosed with HIV, is there challenges with different geographic areas of where that patient might live in accessing care?
In Thailand, the access to HIV testing is actually free, and the treatment is also free. It's under the universal health coverage for the Thai citizen. But then again, the barriers and the challenge will go back to the same issue as the stigma and discrimination that's still going in the healthcare setting. So if a trans person got found out to have HIV at the facility, the thing is, even if the person can get, the testing for free, the treatment for free, but if the service is not friendly, if the service is not cater or tailor for trans-friendly services. There might be cases. What happened in Thailand is that lots of people will drop out from the treatment, or they may delay themselves to go to the treatment because they, again, fear of getting the stigma, discrimination. They have lots of anxiety of the thing that they have to face at the health facility. And I think that would be like the whole picture of what's going on right now in Thailand for most of the trans community.
With respect to, accessing HIV care services once a diagnosis is made in the US, again, I think there's some places that are really doing just a phenomenal job of linking people to care, getting them on therapy, as soon as possible, same day in some instances. But I would say that experience is definitely not uniform across the country. And so, again, while we can hold up amazing examples and some cities that have done just a tremendous job getting access to HIV care for all people, I think that is certainly not the norm. And we can look to those other places as great examples of what's possible and try to emulate what they've done. But I do still think we have a long way to go to reach all people, and in this instance, particularly transgender people.
So hearing from both perspectives from Thailand and the United States, it sounds like regardless of the geographic location, stigma and discrimination play a major barrier in transgender people living with HIV to access HIV care. So let's move on to our next section, talking about co-locating services. Jemma, from your experience as an advocate, what do we need to know about the priorities of transgender people living with HIV? What have clients told you about their perspectives or priorities about gender-affirming care versus HIV care, and how should that play into how we deliver services?
Based on my experience as a trans person myself, and as someone that's been working with the community for quite a long time, more than about 10 years, I think the gender-affirming healthcare is inseparable from any kind of priority healthcare. So when we talk about HIV treatment, HIV prevention, HIV testing, or any kind of HIV services or STI-related services, they have to come together with gender-affirming healthcare. I think it has to be integrated. And according to my work at my clinic here in Bangkok, we also have based on our own setting, we have seen the evidences that the gender-affirming healthcare is actually the main entry or the main attraction for our clients. So the majority of the clients coming in for the gender-affirming healthcare, and then we can always integrate and offer other kind of services that they might be interested, including HIV and STI prevention and treatment as well.
Yeah, so I think complete integration of gender-affirming care, and in this case, I'm thinking specifically about hormones with HIV care. I think that uptake of that is increasing. It's certainly in our US DHHS HIV guidelines that integrated care, meaning gender-affirming care and HIV care being provided by the same clinician in the same clinical visit, is really the ideal and really the goal. I think that the reality is people are still either, making referrals out to other specialty clinics for gender-affirming care in addition to HIV care. And when we think about having people that are already feeling stigmatized and discriminated against by the healthcare system, then having to go out and seek care at two different places, it really, not only just increases the inconvenience, but it increases the probability that they're going to have another bad experience. And so really what, I think the goal should be is to completely integrate that care within the same clinical location and ideally the same clinical provider. I think we're kind of in a process, particularly in the US, where people are starting to learn how to do HIV providers are also starting to learn how to do gender affirming care and provide hormones as well, within the same clinical context. And that really is the goal, I think, for our patients with HIV, that they not have to seek out care elsewhere, that's able to be provided within their HIV care home. Traditionally, I think HIV care services are provided in a more, affirming and inclusive environment, just based on the history and the patients that we've always served. And so I think we tend to be more at the leading edge of these kind of inclusive policies on training our staff, on incorporating ways to make sure that that trans people in particular feel comfortable and feel affirmed in the environment. And so I think it's a great place for us to really begin to fully integrate hormone therapy in particular into the HIV clinic.
Okay, and one of the unique concerns for the trans community that I have it very often, like all the often asked question would be the concerns about the drug interaction between the gender-affirming hormone and ARV. So that's always the question from the community. Like they have the concern that if they are on gender-affirming hormone, would that make the effectiveness of the ARV going down, or if the ARV would actually bring down the effectiveness of the gender-affirming care medication that they take. So as long as we can offer any kind of information that available for them to ensure them that they can have the regimen that go together, that they can actually take both of them together without having any worry this. And the other thing is also about the gender-affirming care, because most of the time when people find out that they have HIV, they often have questions about would they be available to have any kind of surgery in the future? Would living with HIV prevent them from doing that? And that can be one of the main concerns, especially for among the young trans people, because they might have their dreams of their gender transitioning in the future. So as long as we have the information available to be able to ensure with them that everything is fine, it can be done, and we can have the information for them. And it even better if we can have other contact for the surgeons, other contact or information that they can reach to, or even if we have some kind of leaflet, any kind of information available at hand to make them sure that if they can carry on taking that treatment while carry on having that gender affirming routine as well.
Yeah, I absolutely agree. Drug interactions, some people prioritize their gender affirming hormones above their ART and vice versa. Some people prioritize their ART above their gender affirming hormones. And really having that conversation about drug interactions and there honestly being no conclusive evidence that there are, clinically significant interactions one way or the other is really an important conversation to have when you're initiating either gender affirming hormones or HIV care with patients, just to allay their fears and let them know that we don't expect to see significant interactions, but if we did see anything, we'd be monitoring. We can monitor hormone levels. We obviously monitor HIV viral loads in care, and that we can react if we see something that is concerning with respect to a drug interaction. But in general, there's not too much to worry about, that we can safely provide both gender affirming hormone therapy and effective ART, and people can do really, really well with both. I do think it's important with hormone therapy, though, also to understand and communicate expectations around what is possible as far as effects, feminizing or masculinizing effects, and what the timeline for those effects are. Because in some instances, people will take more hormones than is necessarily prescribed, or they might seek it from outside because they think that they're either going to get a faster response or they think they're going to get a greater physical masculinizing or feminizing response from the hormones if they just take more of it. And so I think we do need to do a lot of education around the risk of doing that, and that is the setting where we start to see some of the side effects and some of the adverse events that we're trying to avoid, such as thrombosis or cardiovascular events, et cetera. And so I think that's an important conversation. And with respect to surgery, I live in an area where gender affirming surgery is not widely available. There are a few providers and not all procedures are available in our area. And I'm thinking specifically a bottom surgery is not available in this area. And so we're often having to refer people out to places that are very far away that insurance won't cover, or if they don't have insurance, that will be self-pay. And these are very expensive procedures. And so I think we're still in an environment where access to surgery is extremely limited for transgender people. And hopefully that changes in the future. But yes, knowing who you can refer to for someone that wants to seek surgical procedures is an important pathway to have for your patients as well.
Yeah, if I can add a few more things about the treatment here. I'm not sure if that happened in the States as well, but in Thailand, we have something like natural remedies or local remedies. And we need to have information at hand about the treatment, and we have to offer the treatment, right in time as well. Otherwise, if we delay the treatment, lots of people, according to my own experience, they might fall out of the system and trying to get access to those natural remedies because they think that it will be good for themselves. It will be good in the long term because they sometimes they think that taking the medication can be bad for their body. So relying on the natural remedies, which we have to, like Dr. Colleen just says, we have to have all the information and, to give the education about the treatment and offering treatment right at the spot, same day, would be one of the best solution on that.
Yeah, absolutely. Understanding what treatments people may be accessing outside of the clinic, be it a natural remedy or be it, street hormones in the US. And I know in Thailand, people will use oral contraceptives from the pharmacy that they can use for gender affirming care. And so, yes, absolutely understanding the full picture of what people are taking is very, very important to, ensure their safety and ensure that they're going to be healthy for the long term.
You both brought up so many great points in terms of co-locating services, primarily really a focus on gender affirming care. There's been a lot of talk about whole person care or person-centered care. So let's pivot and talk about that. Dr. Kelley, what are some extenuating circumstances that you've seen transgender people deal with that healthcare professionals need to know about when providing HIV care?
Yeah, absolutely. So, it's not just about hormones and ART, right? So, in order for our transgender patients to achieve whole person care, there are various other issues that are more prevalent in the trans community, in people living with HIV, that have to do with trauma, with being a member of a discriminated population and the trauma that goes along with that often brings with it mental health issues and then substance use disorders as well. These are things that are prevalent in this population, and we need to be sure that we are addressing. In addition, not forgetting that violence and intimate partner violence is also very prevalent among trans populations, and that really, understanding all of the things that are contributing to the health of the patient in front of you, again, whole person care and person-centered care is very important for trans people that are living with HIV.
From your perspective as a patient advocate, what are some other things that you've seen transgender people would like to also address as they receive whole person care?
Oh, thank you. I agree with Dr. Colleen on other related health issues. As in, we're taking care of someone, it's all about their health issue. It's not just HIV and treatment, right? And we also found the same thing here in Bangkok, in Thailand, that where I serve the trans community, that we also have mental health issues, substance use issue. And the other thing is we also have people from different backgrounds and lots of intersectionality, like we're taking care of transgender sex workers, we're taking care of the non-Thai gender, and even some refugee as well that come to the clinic. So we have to be able to offer the services and take care of them in the individual levels and see, whatever we can offer, what can we help them, and not just about HIV treatment. And basically, most of the trans people, they may see HIV as one part of the whole holistic care for them. Can be lots of other kind of health issues and health related issues. And in the condition like here in Thailand, as I mentioned earlier, that we do not have gender recognition law, we still not being seen under the public health system. There are so many access barriers that prevent us from getting all the access to healthcare, to, I would say, healthcare in general. For example, if someone like me goes to the hospital and if I have to be admitted, I will have to be admitted in the male ward and using all the male facility. And also because of, my ID would still say that I was born a man, my gender title is Mr. It can be, again, barriers for not just HIV or access to HIV treatment. It can be all kind of healthcare or healthcare routine in general.
Yeah, I think that those are very important points. And while we may have some acceptance in certain instances of gender affirming use of appropriate names and legal recognition in the US, it doesn't mean that there's not also still that discrimination, even with the legal affirmation of someone's name. So I think it's really important to bring up harm reduction in this setting as well. And when we think about all of the issues that are facing transgender people, and if substance use or mental health care, or even something like sharing hormones with other transgender people who don't have access to them, all of these things may or may not be happening. And I think being knowledgeable about that and then employing good harm reduction principles for people, and educating them about how to engage in some of these behaviors most safely is really important. And that's how you will build a more trusting relationship with the patient, but also ensure that over time that their health can improve. So just to make that comment as well.
If I can add a little bit more on that, I think one of the important things here could be the gender sensitivity of the healthcare providers. I think that helps a lot, especially, like in country like Thailand, where you don't have gender recognition law, as I mentioned now and again, that we don't have a proper health policy for trans people. And most of the time, even though the healthcare provider being nice and friendly, that often that they communicate with the trans people without knowing that they actually stigmatizing and discriminating against the person without knowing that. So having some kind of gender sensitivity training courses, any kind of do's and don'ts guidelines for the healthcare service provider would be very, very helpful.
Yeah, and let's not forget that, some of our clinical settings are extremely large, and transgender people, when they're accessing healthcare, are going to encounter all kinds of different people, from the person at the front desk who's checking them in, to the person that is drawing their blood, to the person that is in the pharmacy. In addition to the actual clinical provider-patient relationship, we have to think about the entire environment and how the entire environment may or may not be welcoming to people with gender diverse experiences. And so I think you're absolutely right. It's very important when we think about training. In our clinics and our healthcare settings, it goes far beyond just the clinician patient relationship to the entire environment, that healthcare environment that patient may be accessing for care, and ensuring that it is gender affirming in all instances. It's really a tall order to be able to do that. But I think that, there is progress that can be made in small steps. And I think looking for those opportunities to make progress in creating a gender affirming environment is really important, even if it's as simple as asking someone's pronouns when they first access the clinic, or even wearing pronoun buttons. That's a pretty popular thing here to do in the US, to let people know, hey, it's okay. You share, I'm sharing, you feel free to share back with me. These are small things that, while they don't feel like that they're that monumental in creating change, that will progress, I think, the environment to becoming more gender affirming.
I remember when we were preparing for this podcast, you shared, was it secret shoppers that used in your clinic to observe how people interacted with your client? Can you share more about that? Because I thought it was just so interesting to hear.
We have done that 2 consecutive years already, so that we can actually hear the actual experience from the person that come to the clinic. Because part of my role here, not just providing the services, is also to make sure that people that come to the clinic, they have the stigma, discrimination-free feeling and experiences. Even though we're trying to do so many things to make the clinic friendly, the staff friendly, even the medical registration paperwork friendly, but then again, we want to see and hear from the person, from their actual experience. And I think it has been a very, very good way to actually get the feedback. And then you can use the feedback back to the team and see how can we improve the services. And I would say it could be a very, very good model, any kind of clinic setting to try.
I think that's a super cool idea. And yeah, I'd like to bring that back to our own clinical leadership to see if that's something they think would be possible, but that sounds like a great idea to me.
I think has something to do about the operation times as well. Because I mentioned earlier that, people living with HIV or trans people in general, they have different backgrounds. Maybe they have different kind of job and different kind of age range. So if you can be very flexible about the operating hours, that would be very, very helpful. And for us, we open from Monday to Saturday and from 10 to 7. And we still think about, if we can extend any hour. And right now, we also often offer the telehealth services as well for those that are not be able to make their way to the clinic. So we try to create lots of choices or access to the services. Like for if they like to come to the clinic, we have the flexible hours. If they are able to come to the clinic, we offer telehealth and we offer lots of delivery stuff. Like we can do delivery for even for the testing like HIV self-test that we can do delivery as well. And also offer any kind of, service. We will call it like express service or speed up service that we allow people to come in and get a very quick turnaround that they don't have to spend a long time at the clinic as well. So that can cater to most of the people.
Yeah, I think a variety of options and how people access clinical care, when, how quickly, all of these things are going to, help people be able to prioritize their healthcare in their very busy lives and all of the competing issues that they're dealing with. And one issue that we didn't cover that is a terrible problem in the US is housing and getting folks access to housing. If they don't have a good place to stay and a safe place to be, prioritizing healthcare really falls to the bottom. And so this is really an issue that we're facing for, lots of people in the US, but it's really amplified among people with HIV and amplified even further among transgender people with HIV who, tend to be the most marginalized groups that we care for. And so remembering that, where people are staying, if it's unstable, if it's unsafe, that's going to prevent them from really prioritizing their health care.
You mentioned about the lack of gender recognition laws in Thailand. And I know before when we spoke, you mentioned trans people are starting from zero. Can you talk more about this and elaborate on this?
Yes, when I talk about gender recognition law, it's very important because it's not just about being visible or being recognized officially or legally from the government. And it's not just about access to healthcare. I think it's all about other thing else in the aspect of our life as a trans person as well. Having no gender recognition law, it can be a big barrier to employment, to education, to healthcare, and to many, many kind of social benefits that we are supposed to have, but we are being missed out from the system. So this is something that we are trying to work with the government to turn the table around to get this gender recognition. And we believe that if that happens, if that law is in place in Thailand, that would increase, the access to healthcare to the trans people in Thailand. And I believe that would also increase the access to HIV services and HIV treatment as well. And come along with that would be the increase to access to all kind of help in general. So it is very, very important. This is something that we advocate for right now. And the other thing that we work on is that once we have the gender recognition law, we will be visible under the eyes of the Ministry of Public Health, and then it will bring along the proper transgender health policy that would open the access. And then trans people can actually get access, I would say, across the country. Because right now, the clinic where I work, even if we looking or taking care, of quite a lot of trans person, but then again, it wouldn't be enough to serve for the transgender in the whole nation. So if we have gender recognition law, if we have proper transgender health policy, then the trans people across the country will be able to get access to their nearest health facility. And the other thing that I'd like to add would be that we want to, right now we work very hard to advocate and to justify with the government to add gender-affirming healthcare under the National Health Coverage System so that people aren't able to afford for those kind of service can get that covered. And again, we believe that it will also be the way to increase the access to HIV and HIV treatment as well. So that's are the very important thing that we are working on right now, apart from offering health services. And while we're offering health services right now, we're collecting all the information on the data so that we can justify using the data to change the policy.
Thank you for sharing that. And both of you today just brought up so many great points, so many things for our listeners to consider. So what would you say are the key take-home messages?
I mean, I think we've spoken a lot about, the environment that transgender people exist in as being, extremely stigmatizing and discriminating, and having kind of sensitivity and understanding and empathy towards that when they do seek healthcare, and understanding the significant challenges that they may face to even walk in the door, and is really important. I think understanding what your patient with HIV that may be interested in gender affirming hormones, what they're prioritizing, their hormones and their ART versus their ART and their hormones, and really educating and explaining how both can be delivered safely with the effects that the person is hoping for is also important. I think, and in that vein, really HIV care and gender affirming hormone therapy are best delivered in an integrated model, but also understanding that is probably currently not the norm in the US, but something that is definitely increasing in prevalence for patients. And that's a very good thing over time as people become more comfortable and more experienced with providing hormone therapy for gender diverse people. And then finally, we spoke about whole person care. And I think that understanding that the medical issues and taking medicines and swallowing pills may not be someone's top priority, because they're also dealing with mental health issues or substance use issues or housing issues or any number of violence in the home, any number of really, really critical factors that they're dealing with that may result in them not being able to adhere to their ART or not being using hormone therapy in the way that it's prescribed. And so just recognizing this and approaching patients with an open mind and accepting demeanor and really trying to help in the ways that we can, I think is important.
I totally agree with Dr. Colleen. And I think what I like to share as my final point of view would be that we are still facing lots of stigma and discrimination. And then we have lots of studies and researches that, prove that it's still happening. Not sure about, other places, not sure about in the States, but in Thailand here, I think we still need lots of allies, people that would support us, people that would understand that we are in the situation where we are being recognized, and most of the time we are still being the target of stigma and discrimination. We still have lots and lots of issues that we do not get fair treatment, or we do not get the fair offer from the government. And so we still facing lots of barriers trying to get access to healthcare. So what we need is that we need an ally, lots and lots of allies who understand and who want to support us so that we can have the power of the people to help us to move and change the policy, which we believe that, right now we work at the clinic, and our clinic is a transgender-led health clinic. And we still need lots and lots of support to be able to justify with the government to actually turn this table around. And that will open up and unlock all the barriers to healthcare, including HIV servicing, HIV treatment for the trans people. And first and foremost, right now, even if we don't have most of the policy or protective policy in place, I think the most important thing is that if you taking care of transgender client or transgender patient right now, I think the very first thing would be how can you offer the friendly services? How can you build trust with them? And I think for me, that is the very first and foremost thing as a trans person. I mean, even if there's no law and regulation, but if I go to your clinic and I feel like I am being welcome, that I am safe, that you are giving me all the respect. I think that that's the most important thing that's count as the minimum. Yes. But if we want to go beyond that, there's so many things we can do. And I believe in choices. The more choices that you can offer and the more flexibility that you can offer together with the friendliness, that would be the most important thing that most of the trans people would ask for from the healthcare service provider.
Yes, I could not agree more. I think as an individual healthcare provider, sometimes it can be overwhelming to think about all of the various structural issues that are, affecting our patients. But I think if you just start small and start by being an ally and look for the ways that you individually or the people that in your environment that you do have influence over can create a more gender affirming healthcare space for our patients, that in itself is a tremendous step forward as we continue to try and address the larger issues that are affecting our patients. So I think that being an ally first is where it all starts.
And I'd like to call for all the doctors and healthcare service providers that might be listening right now to be our allies. Because first of all, if you're taking care, one of us right now, being an ally would make me feel safe, and feel like we want to be in the system. We don't want to fall out from the system. And the other thing is the more allies we have from the healthcare service provider, it will be the more powerful voice for us to make a change.
Thank you so much for sharing those key take-home points and the importance of why and how to be an ally. So I hope our listeners can take away that even the smallest things, being nice, being welcome, can really go a long way. There's a lot of work to do, but I know that you both have shared so many different perspectives that I think will go a long way for those listening. As a reminder, to view the full program entitled Transcending Barriers, Transforming Outcomes, click on the link in the show notes. And to get access to all our new podcasts, subscribe to the CCO Infectious Disease Podcast on Apple Podcasts, Google Podcasts, or Spotify. Thank you and have a great day.